Let's talk about what to do to prepare yourself to take medicine so that it has optimal therapeutic effect. This session is loaded with simple yet really important tips for things to do to create the ideal environment when taking your medicine. And when we talk about the ideal environment, that includes both your outer and your inner environments. And your outer environment is your external physical surroundings. By inner environment, we mean what's happening inside of you, either mentally, emotionally, or physically. The goal is to ensure that you have a smooth and comfortable entry into your new treatment plan, in which we work towards the goal of reaching your optimal dose. And this is defined as the least amount of cannabis to get your therapeutic effect, with minimal side effects and maximum benefit. Let's start with the guidelines for a supportive outer environment. Your surroundings in which you take your medicine matter. The goal is to do what feels safe, secure, and confident. You won't always have control of your surroundings when taking medicine, so use these guidelines as much as possible, and especially when you're taking your medicine for the first time or when you're increasing your dosage. The preparation doesn't take long, and with a little practice, you're going to be able to replicate this ritual in a few moments wherever you are. There are 3 key points to consider. The first is to clear your schedule. Now be sure that you don't have to rush off to anything straight after taking a dose, especially when you're getting used to the feeling of how your body responds to cannabis. Remember, depending on your intake method and your dosing quantity, the onset of sensations can take 45 minutes or more. And if you're used to taking medicine and maintaining your normal routine, whether that's work or play or your social activities and adventures, this may not apply. Whenever possible though, get yourself into a routine where you take your dosages at the same time each day. The more you ritualise your practice, the easier it becomes to make it a natural part of your day. And one thing to consider is the timing of your dose to be taken approximately 1 to 2 hours after any pharmaceuticals or supplements. This is to help ensure that you gain benefit from all of the medicines in your regimen. The second key point is to create a comfortable space. And whatever comfort means for you is going to be absolutely perfect. So it may be settling into your favourite chair, or listening to music that you really enjoy. And having a general distraction-free area seems to be important. But if you're out in public, seek out as comfortable and quiet a space as you can. You'll be surprised how settled you can feel even when there is some commotion going on around you. And the final key point is to have some support accessible. Have an adult support person close by. Now this might be your partner, a friend, a caregiver, or a parent. Personally, I feel a pet is also another great option as support to have around. And if you find that you're unable to have someone physically there with you, no problem at all. Perhaps you can have someone available by phone. I invite you to take a moment to pause the video now and jot down a few notes. Now that might be mentally or actually writing them down on what your ideal outer environment might look like. And as you ponder, consider what is the best time of day for you to take your medicine based on the prescription you've received, where you can best clear your schedule. What are the ways that you can create a comfortable space for yourself? Who will you have there as support? And what equipment might be useful for you to have? All right, great. That's a wrap on preparing your outer environment to take medicine. To recap, remember, clear your schedule, create a comfortable space, have some support accessible, and use proper dosing equipment for accuracy.